Hello out there in television land. Welcome to yet another edition of It's Your Health, the fastest 30 minutes in television history. I'm here with my bride, Kathleen.
It seems like it's been such a long time since we've been here.
It does, doesn't it? Time goes fast when you're having fun, I suppose.
That's for sure.
But make sure you check with your healthcare provider before doing any of the things that we talk about here on It's Your Health. We'll be right back after this brief commercial message. Remember, you're watching It's Your Health, your leader in healthcare information. Be right back. Welcome back to the first segment of It's Your Health. And you know, the thing that is overwhelming, and it's the elephant in the room, if you will, is what's going on with this COVID. It seems like it's making a comeback. People who are vaccinated are getting the illness. It's making a resurgence. There's Delta variants. It's being written, rewritten, magnified as we go on.
People don't know when to wear a mask and when not to wear a mask.
Right. Well, I'm not wearing a mask now, right? So.
Well, that's because it's just the two of us.
Oh,
it's like being at home together, you know, and Donnie, the two of us and Donnie.
Well, then moving right along, maybe we could do some headlines. We're going to structure all of our headlines, which of course open up our segments, and they're all going to be COVID related.
But they're all going to be question answer, and I get to do the questions and he has to answer them. So here we go. Is it safe for me to get a COVID-19 vaccine if I would like to have a baby one day?
As with most vaccines, there should not be a problem with fertility, and according to the studies that we have so far on this COVID-19, there should not be a problem with fertility. And again, there's so much misinformation out there. And it leads me to think about when we were growing up, who said, listen, I'm not going to get the polio vaccine, or I'm not going to get the smallpox vaccine. You know, there wasn't this pushback, and I just don't
Which was the vaccine on the sugar cube?
That was polio.
Oh, I remember standing in line to get that.
Mm-hmm. So again, it's just very crazy and sometimes dark times.
Well, let's go to the next question. Can a COVID-19 vaccine make me sick with COVID-19?
No, because it is not a live vaccine. And what it does is it changes some of your cells, which we're going to get into briefly, on how to recognize the COVID-19 virus. Now, that doesn't mean you may not get a side effect from the vaccine itself. I think we all kind of felt we got kicked when we took the vaccine. But nevertheless, it's not going to impart a COVID-19 infection in you.
And the signs and symptoms we get are signs that the body is building up protection for us. So it's actually a good thing.
That is a good point, because when people say, geez, you know, I feel like I got vaccinated, well, then the vaccine is doing its job.
Yeah, I felt it when I got my vaccine, that's for sure.
I was cooking and cleaning all day for you, so.
Oh, the poor man. Now, the next question starts off with mRNA. What does mRNA mean?
Right, well, there's two types of genetic material in our body. There's DNA, which of course you might be familiar with, and then there's RNA, which stands for a different type of genetic material. And this vaccine hits the mRNA, and the M stands for mitochondrial.
Is the mRNA vaccine considered a vaccine?
Well, it's a vaccine in a sense that it's going to bring about an immune response when it's injected into your body, but it doesn't contain live or parts of a vaccine such as influenza might. After you are vaccinated with COVID-19, it creates these proteins, these spikes, and it tricks the body into saying, you know what, these spikes don't belong here, and I'm going to react against that. So you build antibodies against these spike proteins. The second shot shows what the COVID virus looks like. It has spikes on it as well. And so your body says, hey, We already know this character. We built antibodies against it, so we're not going to let this get in your system and infect you. So the vaccine starts by giving you these spike proteins, which your body reacts against, so that when the real deal comes along, you're already going to be having antibodies against it, and it will not enter your system and create havoc. And if it does, it's not going to be perhaps as great.
And that's different than the flu and the measles vaccines.
Correct, correct. They don't make these cellular changes that your body would react to.
People often ask this question, what shall I expect after getting the COVID-19 vaccine? What are the common side effects?
Well, you're going to feel perhaps a sore arm. You might feel like you have the flu, maybe a fever, chills, body aches, pains. You might have some GI symptoms. I think you're going to know that perhaps you've been hit, if you will. And they generally are self-limited and go away in a few days. I personally have not heard or seen any serious reactions to the COVID-19 vaccine.
I know one of the things they told me was drink lots of fluids.
Yeah, drink a lot of fluids and just try to go low and go slow for a couple days.
And how do you know when to call the doctor?
I think if you're experiencing high fever, chest pain, shortness of breath, you have nausea, vomiting, or are getting sicker, if you will, then you may need to seek medical attention.
Okay, is that it now for COVID for this section?
For now, yes.
For now, okay. And let's go on to physical activity and how it helps to prevent depression. Physical activity appears to be associated with a lower risk of developing depression and depressive symptoms. It's a statistically significant increase in depression for those not physically active and those who have just 1 or 2 hours a week of physical activity. There is a big difference in your ability to not be depressed.
Well, there's no doubt that if you can get out and move around, you're going to feel better, you're going to look better. And again, we are in a society that thinks there's a pill for every ill. And as we enter the fall time, we start maybe feeling a little melancholy. It gets darker earlier, darker longer, a little chill in the air. And nevertheless, if people are out there in television land and they're at least exercising, not heavy duty stuff, even just a walk up to 1 or 2 hours a week, you may lower the chance of falling into a depressive state.
I notice now that I'm walking the dog more often, that I'm in a better frame of mind with the walking. And they're not asking for much. They're saying 1 to 2 hours a week. That's not much.
Not bad at all. Not
no,
bad
it
at
isn't.
All. We are almost done with our first segment, believe it or not.
Oh, my goodness.
I told you it's the fastest half hour.
Well, do you want to, do we have time to show a picture or shall we wait?
No, show the picture.
Okay. Does that look like us?
No. What happened?
Do you remember when you used to take me to expensive places? Back when we were young and dating and you wanted to impress me? What happened? You don't take me to expensive places anymore. Take me somewhere expensive.
You want to go to a place expensive?
Yeah.
All right. Right after the show, we're going to go to a gas station. All right?
We'll be right back. Welcome back to It's Your Health. And this is our second segment of our all COVID all day, practically.
And night.
And we have our next set of headlines, which are all COVID related. So there are questions for you, Doc. Here's the first one. Do any of the COVID-19 vaccines authorized for use in the United States shed or release any of their components?
No, these vaccines do not release anything of their components. As we illustrated earlier, it manufactures these fake proteins on your cell, which your body reacts to, and then it's ready for the COVID-19 virus.
An important thing is it doesn't contain a live virus.
Correct.
Right?
That's a big thing.
Okay. Next question. Will a COVID-19 vaccine affect my DNA?
No.
Or alter my DNA, more importantly.
No, it will not. Again, we said in the other segment, it's RNA bound, if you will, or at least affecting that part of your genetic. It will not affect your DNA or anything of your genetic material.
It doesn't enter the nucleus of your cell, and that's where your DNA is. So you're pretty safe. Will getting a COVID-19 vaccine cause me to test positive for COVID-19 on a viral test?
No, it won't. What may happen is that if you are vaccinated and then go for a blood test to see if you have antibodies, we would hope that you have a positive test showing that the vaccine worked and it caused antibodies to be released. But if you get a nasal swab and get checked for COVID-19, it's going to be negative because the vaccine doesn't do that.
I hate to not sound like I know anything, but I don't. What do you mean by antibody?
Right. Well, the antibody is an immune response that our body makes that will recognize what belongs to us and what doesn't belong to us. So that's the whole principle of getting a vaccination. I could be exposed to polio virus, for example, or mumps or measles. I won't get it because as a child, I got immunized and my body knows that doesn't belong in our system and will fight it if I'm exposed to it.
Off the topic a little bit, measles. Do we have to get a measles vaccine again once we're adults?
Generally not. I've not heard of that kind of thing.
Okay. That just came up as a question to me, and I didn't know the answer. Oh, all right. So let's go off COVID for a minute and talk about the alphabet. A, B, C, D, E, F is how far it goes. Tell me what that means and what it's about.
Well, we're talking about cardiovascular health, and you're going to check your screen. We're going to go through the ABCs now. For A, it stands for aspirin. I know when years ago we were told to take a baby aspirin every day to reduce stroke and heart attack risk, they now said, well, maybe it's not a good idea because you could get a GI bleed. I think you have to take it up with your doctor. Do I take a GI bleed or do I take a stroke or a heart attack? I personally just take a baby aspirin every day. The B is for blood pressure because that's the silent killer. Just like there's too much air in your tire will cause the tire to wear down prematurely. Your blood pressure is elevated. It will cause your arteries to become hard and break down prematurely. What does the C stand for? Cholesterol in cigarettes. There's a no-brainer there. Low cholesterol and tobacco cessation is crucial. The D stands for diabetes and diet. So there's a lot of people out there that have diabetes or pre-diabetes and don't even know it. So get tested for those things. Obviously, it should be Lent all the time. Try to cut down on the sweets and the goodies and try to maintain some healthy weight loss.
Is that a blood test?
Yes, a blood test. E stands for exercise and education. Sedentary behavior should be avoided, as we talked about earlier. Participate on a weekly basis, getting in some walks. The F stands for failure, and what we're trying to avoid is heart failure, because these combination of inactivity, weight, diabetes, high blood pressure can all lead to failure of the heart, which can be irreversible. So that's sort of the thing and the goal, the ABCs of maintaining cardiovascular health.
Wow, those are very involved ABCs.
But they're easy to do.
They're practical.
Practical is the word, yes.
Okay. A difficult topic now, but one that comes up often for you as a geriatric specialist. How do you know when it's time to consider hospice for somebody you love? It says that people often wait too long.
Well, there's a couple of issues. They claim that 80% of the total Medicare health care dollar for an individual is spent their last 2 years of life. And as the Bible says, no one knows what hour they will be called home. But we're getting into more hospice-related issues because people actually would benefit from hospice services. And the way I view it is it's comfort care. You know, when I die, I want to be at home. I want to be comfortable. I want to have ice cream and morphine and be around loved ones.
What do you mean when you say services? What kind of services
Right.
from hospice?
Hospice is a arm of Medicare, and it's paid for by Medicare, where you get more help, particularly at home, and it changes the whole aspect of your care. If you get sick, you're not going to go to the hospital and you're not going to be admitted. You're going to stay home and get comfortable. Get a load of what we would consider suggestions are for hospice care. If your treatment is no longer working and a patient or family no longer desires aggressive intervention, symptoms are getting harder to manage, visiting the doctor and getting in the hospital more frequently, they need a lot more help than they used to in the past. Patients may seem confused and restless as they are approaching the death and dying process. With that, they are sometimes unable to communicate their needs, and that's why we have power of attorneys and living wills. Losing weight, no appetite, again, is a consideration. If you're basically bedbound and the quality of life isn't there, that might be an indication for hospice service. And of course, what is called caregiver stress, and that's where you have the caregivers actually suffer because of the overwhelming physical and emotional needs that a terminally ill patient requires. So, a tough subject, but it's something that needs to be talked about and looked at, and I hope this will be of value.
Speaking of tough subjects, I know that this is not the place to bring up something personal, but I have to bring up something personal because it's bothering me.
Oh, geez.
Just the other night, we were on the sofa watching TV. I was watching what I wanted, and you were being a good sport. You were rubbing my feet, felt so good. Then you were rubbing my legs, felt so good. Rubbing my back, that felt so good. Then you were rubbing my shoulders, rubbing my neck. I was so relaxed. I felt wonderful. And then you stopped. Why?
Oh, well, I found the remote. So, but don't you touch your remote, because we're going to be coming right back after this brief commercial message. It is a true thing, by the way, that happened.
I'm so sorry I asked.
Okay, now you know. We'll be right back. Welcome back to the third and final segment of It's Your Health. I'm
It goes so fast.
here with my bride. During commercial break, I was trying to look for the remote again, but
I wouldn't let him.
no luck on that.
He can't fool me twice.
Moving right along.
And again, we have COVID headlines. First one, again, a question. If we need a booster shot, does that mean the vaccines aren't working?
No, like anything in life, it doesn't last forever. And these COVID-19 vaccinations, we think, wear off with time. And especially with the resurgent of the virus now, a booster shot is recommended, particularly for Pfizer, and they're talking about the same thing for the Moderna. So it doesn't mean it doesn't work. It just means that perhaps your body needs another kick in the pants.
Okay, so that happens. Next one. What are the risks to getting a booster shot?
Well, I can't say they're any different than getting the vaccine in and of itself. Some people have reactions, some people don't. I myself got a booster shot, which is generally 6 months after your second shot. And I went to work the next day. Perhaps I felt a little tired, but nevertheless, I didn't really have much in the way of symptoms whatsoever. Some people do, some people don't. It's kind of a crapshoot.
I got my booster shot. I was a little bit sick, but it passed. It wasn't anything major. Okay, last COVID question.
All right.
Yay. Am I still considered fully vaccinated if I decide not to get a booster shot?
Yes, you are. And if you were to, for example, get a blood test to see if you have antibodies against the COVID-19 virus, it would probably still show up as positive. What we don't know is just how strong these antibodies are and how much is in your system. We don't measure the amount, we just say whether you have them or not. So I think considering this illness is going to be around for a longer period of time than we like, and there's variants, and God knows what's in store for us, I would tend to recommend getting the booster.
And remember that after you get it, it's 2 weeks before you're
It really kicks
safe,
in. Right, it
so to
really
speak.
kicks in, exactly.
And you wanted to talk a little bit about the flu shot.
Well, we do give flu shots this time of year. It's probably the ideal time, when I always say when they're playing the World Series. The flu shot lasts a couple of months, so if it's given too early, sometimes when we have the flu epidemic after the holidays, it might not be as effective. You can get the flu shot and the COVID-19 vaccine together, just not in the same arm. And it's interesting, I've been doing this 43 years now, and this past year was the first year I did not see a case of influenza.
Not a single case.
Not a single case.
That's because nobody's breathing on anybody.
Well, no, yeah, exactly. We're washing our hands, we're keeping our distance, we're wearing masks. Who knows what this year will be, but I can't recall any influenza cases.
Well, that's something positive for all the trouble people are going to stay clear of everybody.
Yeah.
I was just at the bank, and they've got the things on the floor you stand 6 feet behind each other, you know, so people are being careful. Something else that we need to be careful about, and this is breast cancer awareness. How do you reduce your breast cancer risk?
You know, it's kind of odd because you would not think that we would have as much breast cancer as we do. I mean, you have your breasts, you can examine them, you can mammogram them, and yet nevertheless we're getting case after case. Some of it's genetic, as you may know, and some of it could be related to our diet. I think people that are eating processed foods and meats, we're not following what we had grown up with as cavemen, if you will, or cave persons, sorry. So again, it's kind of an odd thing where we really have to just keep on top of this, because it is one of the #1 cancers that women face.
Well, and one of the things they tell us is, of course, once a month to check a breast for any kind of lumps or anything, but you should also be checking for thickening, swelling, or darkening of the breast, itchiness, a rash, a scaly sore around the nipple, puckering, nipple discharge, or breast pain. Any of those are good enough reason to go to your doctor and to see if they want to maybe have a mammogram done. And know your family history. If you have a first generation person who's had breast cancer, your chances go up exponentially that you may also get breast cancer. Of course, eating well, and that means not so much of the red meat, and finally, regular exercise, which keeps coming up in everything that we talk about.
And another take-home point is, if there's a lump there and you have a negative mammogram, 10% of the time mammograms may not show something that is there or is not there. So you have to act on that. If you have a negative mammogram and a palpable abnormality on physical exam, you got to go after that, see a surgeon, maybe get a biopsy or an ultrasound.
Yeah, biopsies are no fun, by the way. Of course, neither are mammograms.
I wouldn't know, but...
well, I'm telling you, just so you know.
Take your word for it.
But they're important. And something else that's important that we don't talk much about is vitamin B12. It's an essential nutrient for your body. It supports the health of nerves and blood cells and contributes to the production of DNA. And that's vitamin B12. Tell us more.
My sons, when they're with me, I always impart to them a little bit of some knowledge over the ages. And one of the things that astounds me is particularly when I get a new patient from the nursing home or a personal care home, we check their thiamine levels, their vitamin B12 levels, and you would be shocked as to the percentage of those that are low and they're abnormal. And the old thinking was, well, you're not going to check those things if you're not anemic. And unfortunately, life has changed for us. For example, people are on proton pump inhibitors, which lower acid. People are on metformin for diabetes, which lowers the absorption of some of these B vitamins. And if left untreated, unfortunately, it can go on to nerve damage. If I was taking one of my board questions and there was someone here who had dementing illness, B12 deficiency could be part of the problem. They also have associated problems with people with any neurologic disease, such as Parkinson's disease. So these are very crucial water-soluble B1, B6, B12. In other words, your body kind of pees them out if it doesn't need it. But they have to be able to get in. And if they can't get in, then you can suffer damage. And hence, they have B12 shots, because some people, particularly if you're a lighter heritage, Irish, English, they often have B12 deficiencies where they don't absorb.
So it's important that, and you can do it with a mere blood test.
Correct, yeah.
So that's our last headline that we have for today, sir.
Well, I know you talked about not getting any, meats and meat products and things like that, but I think we're going to go to Jimmy's after this, if you don't mind, and we'll
go Jimmy's
with everything on it.
That sounds perfect.
Speaking of perfect, thank you for allowing us to come into your home and inform you and entertain you. I always mix those words together here.
We get what you mean. Thank you, Sammy.
As usual, thank you for being out there. It's always gracious to hear how we heard this on It's Your Health, because that's where we're your leader in healthcare information. Again, till next time, be safe.